Hello guys, this is Dr. Thompson, the instructor of the DeTsquare OET Academy. Today I'll be walking you through on how you can select important gist in any case note that you are given, because some students really find this very difficult to decide which information will they include in their letter writing and which one should they exclude from the letter writing. I'm going to walk you through on how you can acquire this skill, and it will be very, very important that you get this skill in order to write a very good letter writing that should be able to fetch you 350 and above. Now, in OET, usually at the end of the case note, they will always ask you to expand the relevant note into complete sentences. So they said expand the relevant note, not just expand the note, expand the relevant note, meaning it's not everything in the case note you are expected to add in your letter writing. Okay, for you to write a good letter, there are three things that you really need to know how to do. First is how to identify relevant note. Second is how to expand this note, and third is how to complete this note in write this note into complete sentences. But for the purpose of this lecture, we are going to focus on how to identify relevant note. In my subsequent lectures, I'm going to teach you how you can expand this note and how you can translate this note into complete sentences. In order to identify relevant notes in your letter writing, first you have to identify the purpose of the letter. If you are still confused on how to identify the purpose of the letter, I would strongly recommend you go back to my YouTube channel to check how you can identify the purpose of a letter. I've done a video on that, and also how to identify the problem in a case note. Because if you're able to identify the purpose of a letter, you will now ask yourself, why does this reader need to do this for this patient? That is how you can identify the problem in that case note. Now we are going to what you are going to do today. Will focus on these 2 points. First, for you to select any information, ask yourself, will the note help the reader to identify the problem or fulfill the purpose of the letter? In summary, the purpose of the letter is the highlight of what you want the reader to do for the patient, not what you want to do, but what you want the reader to do for the patient. Okay, which boils down on the problem on that case note, what you've identified as the issue, and you want the reader to solve it. All right, so now take a look at this case note. This is a case note, a sample case note that you are going to use. This is where it started from, and this is the second part, and this is the last part of that case note. In every case note, at the bottom of that case note, you always have a writing task where the information, the instruction is given. This is where you usually look out or check for the purpose of the letter. Most time it's stated clearly here. But if you read this information now, here, the purpose of this letter is not clearly stated in this case note. What the reader should do for this patient is not written here at all. So what you do, you go back to the last date in that case note, usually the day you are writing that letter. For example, in this letter, today's date is assumed to be the 13th of June, 2022. Therefore, we go to 13th of June, 2022, which is today, and then we'll check to see what's the summary of what we want the reader to do for this patient. Here said this patient is ready for discharge to nursing home for a short-term monitoring. All right, so it means we want the reader to monitor this patient for a short while. Okay, so monitoring this patient for it temporarily is the purpose of this letter. The next question will now be, why will this patient need short-term monitoring from this nursing home we are discharging this patient to. Now, you have to go from the beginning of that case note to see and check and identify the problem. Now, looking at this case note, this is the patient details. This is where this patient lives. This is patient's name and date of birth. These are the medical conditions that this patient has been managing, and these are the medication the patient has been on. Here is the patient's social background. Looking at this social background, this patient is a widow. The husband died in 2000, and this patient has no children. This patient lives alone, although she's independent and she's a retired bus driver. Now, what is the issue? You have already managed this patient in your own hospital as a nurse. Now, the patient is confused following a fall, which here the patient was admitted and was given some IV fluids, and the dose of the medication, the antihypertensive the patient was taking was reduced, and the patient now finally got better looking at these vital signs. And finally, we are now and finally, looking at the concerns here are that the patient lives alone. She has no support. She's eager to return home. She's still having restricted mobility. Now, the summary of the problem this patient has is that this patient lives alone. She's confused and has restricted movement and would definitely need a support. So that's the problem on ground. That's why we need this nurse for a short-term monitoring. Okay, now having these two details at the back of your mind, you will now start to select information that you are going to include in your case note. I will strongly recommend you do this first before you start writing. First of all, try to highlight the information you want to include in your case note. Otherwise, you will find it difficult. You might end up adding everything in that case note, and they might not be necessary for that reader, and that will impact negatively on your scores. Now, let's start from the beginning of that case note to select information that we are going to add in this letter writing. Now, starting from this patient details, this is the patient name. Definitely, we'll need to add this patient's name in this letter writing. This is the patient date of birth. We'll also need to add this information because it is important to the reader. This is the patient address. This information is not relevant here because looking at why we are writing this letter, we are writing this letter for just short-term monitoring in a nursing home, not in this patient address. So the reader, the address of this patient might not be relevant to this reader, so we will not add it. Now let's go to the medical history. This patient had appendectomy in 1992 and developed osteoarthritis in 2006. In 2009, he was diagnosed of hypertension, and in 2019, he started experiencing headaches of unknown cause, but no treatment is required anyways. So in this case, because these are medical conditions that this patient has, this is already a surgery that was done in 1992, which is several years ago. So this information will not be relevant here because this patient will not need to be monitored on this. Osteoarthritis is important because it's the patient's medical condition. As the nurse is monitoring the patient, you also have to be aware that this patient has osteoarthritis. This patient also has hypertension. The nurse should be aware. This patient has headaches. Although no treatment is required, but the nurse should be aware of this, that this issue is ongoing. In case the patient is in the nursing home and start complaining of headaches, the nurse should be aware that this patient has this medical condition. All right, and now these are the medications the patient is on. We also need to add it because the nurse should be aware that this patient is taking this. It's part of what the nurse should be monitoring as well. Okay, we have to add this. Now, coming to this patient's social background, the nurse should be aware that this patient is a widow. Okay, if you like, you can add when the husband died, but the more important information is that the patient is a widow and has no children. Okay, and this patient lives alone in own flat. The details of this might not be necessary. These details here may not be necessary, but you can let the reader know that this patient actually lives alone. Socialize it with neighbor. Well, this patient is going to a nursing home now, so this information might not be relevant. This patient is independent, cooks, daily works. You might have to let the reader know about this. Okay, this patient is a social drinker. Well, if you like, you add this information, but I don't think this information will be relevant at this point. Any person can be a social drinker. That means the patient is not an alcoholic. There is nothing to monitor there. And the patient takes 10 sticks of cigarettes per day. Well, this is like a habit. So if you let the reader know this information is neither here nor there. So if you like, you can include this information. This patient is a retired bus driver. I really don't think that this information is important. A 90-year-old woman, nobody will expect the 90-year-old woman to be driving anything at this point. So we might not add this information. Now let's go to the next part of this. Okay, we've already discussed the social background. Now this is the presenting complaint that the patient presented with. Definitely the reader has to know what really happened. Now, coming to the hospital admission, we might not go ahead to start telling the reader that this patient fell while climbing stairs on this date. She felt weak, leg gave away, fell backward, hitting head on. These details at this point are not necessary. We've managed this patient. This patient is fine. But it will be important to just summarize all this information in a sentence. Maybe you can let the reader know that this patient was admitted on account of an unwitnessed fall, probably due to an unwitnessed fall. She became disoriented and confused after that and was suspected to have orthostatic hypotension, which was managed with fluids, and the dose of amlodipine was reduced. So you can see the whole of this information. You can just summarize it in one or two sentences instead of adding the whole details in this letter writing, which the reader will not need. There is no need trying to tell the reader that he was placed on IV fluid 2 ml 50 ml per start, then 8 hours. The patient is no longer on these fluids again. The patient is now getting discharged home. So when writing, there are some information you don't need to start telling the reader the whole detail. Okay, it's just for you to summarize the information. That's why it's very important for you to learn how to also summarize information. If I'm to write this, I will summarize all this. Okay, in my subsequent lectures, where I'm going to teach you how to expand your note and form complete sentences, I'm going to write this letter for you, and you'll have a better idea of how you can summarize information. We'll discuss that on how to expand information, but what you are doing today is just how to select important information. Now, coming to the last day, which is today, you are writing this letter. Definitely the reader had to know about this, that this patient lives alone, that this patient is eager to return home, because you are sending this patient to a nursing home for a short-term stay. The readers need to know that this patient is actually want to go home as soon as possible. This patient has restricted mobility. This patient has occasional confusion, and this patient will need assessment of his home. This patient will need a special evaluation to know if the patient can live alone. So these are the information you have to add in your letter writing. After selecting this information, then you should be able to now organize this information and have a fantastic or a very well structured letter. All right, guys, this is where we'll stop today. In our next lesson, I'm going to teach you how you expand your notes and how you can use those notes to form complete sentences. All right, thank you very much. If you like my channel, please do kindly hit the subscribe button, like my channel. You can also join the community where I always ask questions every day. And my live streaming will be coming soon, and you'll be informed about that, where we can review any letter that you post online for us to go through. All right, do have a great day. Bye bye.